Hello, and welcome to Understanding United States Pharmacopoeia USP Standards 795 and 797, and 5 things practices should do now to minimize the impact. I'm Brian Carlson, a partner and consultant with Veterinary Business Builders. At Veterinary Business Builders, we believe in sharing what works, and we hope you find these tips valuable and helpful to your practice. Our agenda today is to discuss what is the United States Pharmacopoeia, why USP 795 and 797 will have an impact on your veterinary practice, how we can take action to minimize those impacts, and ultimately we'll leave you with some resources to support you as you move forward in this process. The United States Pharmacopoeia is an independent, scientific, non-governmental organization, and ultimately it's a good thing. It's there to keep people and pets safe by protecting consumers from counterfeit and substandard products. It sets quality, purity, strength, and identification standards for medicines, food ingredients, and dietary supplements. Now, the USP is not a regulatory body. However, the FDA and most state boards of pharmacies will interpret and enforce their standards. USP 795 and 797 are set to take enforcement on November 1st, 2023, and they are going to apply to state-licensed 503A compounding pharmacies. These are different than FDA-registered 503B compounding pharmacies, which have different regulations and standards that they will need to adhere to. USP 795 is aimed at non-sterile compounded preparations, while 797 is directed at sterile compounded preparations. Ultimately, beyond use dates will be shortened due to the impact of these standards. These standards will shorten the BUDs, or beyond use dates, for many of our medications. And a beyond use date, or a BUD, is a limit assigned due to the lack of stability testing of these compounded medications. So we're going to discuss 5 things that veterinary practices can do now to minimize the impact of these changes. We're going to talk client outreach programs, workflows within our practice, inventory management systems, how to choose the right compounding partner, and embracing technology in our practices. When we think about creating a successful client outreach program, we need to first recognize that our clients and ultimately our patients will be most impacted by these changes. Our clients need to know that they're going to need to order their pets' medications more frequently than they have before. So we need to think about creating customized, personalized, and targeted messages that draw our clients in so that they receive this valuable information. Mrs. Jones, Dr. Ward has new information on Taco's medication. Due to upcoming changes to beyond use dates, we recommend adjusting Taco's auto ship schedule beginning in October. This targets our specific client. It also references her veterinarian in the practice, so she knows this information is coming from a valued and reputable source. And most importantly, it's about her pet, Taco, so she wants to pay attention to it. It gives her the information she needs about what's going to change, and then ends with an actionable step that we can take to make sure that we're minimizing the impact. In addition to those targeted and personalized messages, we also want to leverage social media to reach a broader audience. Whether it's your Facebook page, your Instagram, or whatever social media channels you're using today, we want to create awareness campaigns within our practice. And these are going to be really valuable, not just for our clients that are using compounded medications, but for pet owners who may in the future, or they may know somebody who is using a compounded medication for their pet and will pass that information along. And last up, when we think about creating these client outreach programs, we need to make sure that we're leveraging our pharmacy partners. Reach out to your Wedgwood pharmacy partner and ask them to help you compile a list of your clients that are using compounded medications so that we can reach out to those clients that need this information. Leverage those partnerships with our pharmacies to help us in this outreach. When we think about how we work through the prescribing process in our practice for compounded medications, we have to remember the clock is ticking. The beyond use date starts when that medication is made at the compounding pharmacy. And sometimes those medications can sit due to quality control testing. And then we have delays as they get shipped to our practice or to the pet owner directly. So the clock starts earlier before we even script that medication, and it gets the ball rolling. We have to keep that in mind. So we need to identify efficient workflow protocols within our practice that identify essential team members that can help us move this process along so that we don't create unnecessary delays. And this isn't just veterinarians doing this alone or one or two team members who might know how to handle compounded medications. We need multiple team members who understand their roles and responsibilities in this process so that we can move quickly and efficiently throughout the process. And we need to think about request, approve, dispense, and which team members are going to be involved and have responsibilities and obligations at each step along the way. And finally, doctors, we need to anticipate and authorize refills whenever appropriate. Not every compounded medication calls for refills, but when it does, what is the appropriate amount that we can provide that client so that we don't create unnecessary delays of the client having to reach back out to our practice or to the compounding pharmacy to authorize refills. So whenever appropriate, leverage refills, anticipate and authorize them in advance so that we make sure that our pets keep getting these medications. When we think about our practice management software, it has tremendous potential, and we should be using it for inventory management within our practice. If we are utilizing in practice or office stocked compounded medications, and our states allow for that, because not every state allows for it, but if we are utilizing that, then we need to make sure that we're logging and monitoring those beyond use dates in our practice for our office stock compounds. And again, if your state allows for it, so that we do not have expensive medications outdating on our shelf and costing us time and money. We're also going to use those inventory management systems to determine our average daily sales, our lead times, and our safety stock. And I want to say something about lead time here. If we only order once or twice a week, that needs to get factored into lead time. Lead time is not just shipping, but how long does the entire ordering process take us from start to finish? We're going to take those data points and we're going to create two valuable pieces of information. When do we reorder more? What is our reorder point? Average daily sales multiplied by lead time plus our safety stock. This is going to tell us when do we reorder. And then how much to reorder quantity. And that's going to be our average daily sales multiplied by our lead time. And this is going to allow us to have the correct amount of inventory on our shelves so that we don't have an expensive, costly problem on our hands. We need to think about choosing the right compounding partner. And I say partner here because ultimately, when we choose to compound a medication, it reflects back on our practices and it reflects on the medicine we practice within those practices. So choosing the right partner makes sure that we're setting our client up for success and we look good in the process along the way. So this is an absolute non-starter, but your compounding pharmacy partner needs to be accredited by PCAB, which is the Pharmacy Compounding Accreditation Board. This is a must-have in your compounding partner. We also want to look for compounding partners that have 503B capabilities, like Wedgwood Connect. Can they use FDA registered 503B compounding channels? And we'll talk about why that's important in a minute. We want to know, is our compounding partner investing in stability testing? Stability testing is expensive, but when a compounding pharmacy does stability testing, it can demonstrate longer beyond use dates and allow us to have the longest beyond use date available to our practices. Do they offer us digital or online scripting options, which allow us to enter prescriptions when it's convenient for us and allow our clients to buy them when it's convenient for them? Or do they only require that we phone or fax and they're only responsive when their compounding pharmacy is open? That's just not going to work when we have these accelerated timelines. Lastly, are they providing support as we navigate these changes along the way? Things are evolving. Regulations are getting updated. What kind of support resources? Do you have questions? Can they answer them? Your compounding partner needs to be able to navigate these changes with you. Last up, we want to make sure that we're embracing technology in our practices. And what do I mean by that? Prescribing platforms, home delivery, online pharmacies. These platforms offer us the greatest flexibility within our practice to get prescription medications to our clients. And we want to make sure that we're leveraging these technologies to reach our client where they're already shopping. They're already online. They want a method of getting their pets prescriptions when it's easy and convenient for them or when they remember. For some of us, we have busy days and busy lives, and the first chance we get to think about our pet's medication is going to be late at night. It's after the practice is closed or the compounding pharmacy is no longer open. Prescribing platforms, e-commerce, online pharmacy, home delivery, these offer us the ability to meet our evolving client expectations. They also offer us a really valuable tool like AutoShip, where we can create a set it and forget it mindset with our compounded medications. Now, AutoShip is an incredibly valuable tool because what we're able to do is take something off of the client's to-do list, and they are going to love you for that. And the medications are going to show up at their door when their pets need them most. And remember, because they may need to order more frequently, we want to make sure that we have that continuity of therapy, and AutoShip allows us to do that. Now, there is an asterisk here on set it and forget it. We're not forgetting forever. We need to make sure that our AutoShip schedules dovetail with our medical protocols. What are our therapeutic monitoring panels? How frequently do we need those? Are they due for a wellness exam, a biannual wellness exam? Set AutoShip schedules to dovetail with those important medical protocols you've established in your practice to make sure we're driving clients back into the practice for those important, valuable services, but we're not creating disruption to the continuity of therapy for the pet. I want to take a second to acknowledge what Wedgwood Pharmacy is doing to respond to some of these changes. First off, they are making investments in the stability testing at their 503A pharmacies to allow for the longest beyond date use possible. This is great. Not every pharmacy will be able to do this. So it's really important that we use pharmacies that are investing in this expensive stability testing to allow us to have the longest beyond use date possible. They're also shifting more medications to their FDA registered 503B facilities. And because these facilities have different standards and regulations, they too are also going to have longer beyond use dates. So we're going to have more medications with the best beyond use dates possible. And finally, they're going to continue to advocate for us in the veterinary community because they know the challenges we are up against, and they are talking to the FDA and the USP and the state boards of pharmacies and giving us a voice in an arena that we don't generally have one. And it's really important that we have advocates for the veterinary community when we think about these standards and the impact they'll have on us. And finally, we told you that we were going to leave you with some resources. So we've got a QR code and a link here to some really great resources that Wedgwood Pharmacy has put together on USP standards. If you need to know more as things evolve, use the QR code, use the link, make sure that you're keeping up to date, and know that Wedgwood will support you along the way. And that's it. That's all we've got for today. So I hope that you found this valuable. On behalf of Veterinary Business Builders, I thank you for spending the time here today and really, truly wish you the best success in your practice. Thank you.